Our patients gave us the idea for the care bags when they told us that they were struggling in the emergency department. We recognised that there was a health inequality because people with a learning disability and autistic people were leaving and coming back to the emergency department more than other people were. We want to get care right the first time. We want people to be able to stay in the department for long enough to access the care and the treatment that they need. People with learning disabilities and autistic people helped us to develop the care bags, along with our colleagues who work in the emergency department. With the help of Leeds Hospitals Charity, we started a pilot in 2022. A care bag is now offered to every autistic patient or patient with a learning disability who attends our emergency department or one of our acute areas.
When we were approached by the team in 2021 to fund a pilot project for the care bags, I was really excited about this opportunity. Since the initial success of the pilot project, Leeds Hospitals Charity has been able to extend the funding to roll out these care bags across different areas of the hospital. They're now being used within the emergency departments, within the surgical assessment centre and in the walk-in centre. Over 1,500 care bags have been used in different areas of Leeds teaching hospitals since the launch of this project.
We found that the bags have actually enabled the patients massively to be able to support themselves and manage their own needs. The staff also feel empowered. They can actually give these to the patient and it does help them to manage the patient's anxiety. From such a small thing, it makes a massive, massive difference.
As soon as I see that I have a patient who is either autistic or has learning disabilities, I'll approach them, introduce myself, and I will see if they would be interested in one of our acute ED care bags that we have here. These bags are absolutely fantastic for patients with additional sensory needs who may struggle with the sensory overload of being within an A&E department. Just the little things like lights, noises, things like that, which these bags provide. Sometimes ear defenders, fidget spinners, fidget toys, colouring books and lots of distraction methods, which I found for my patients work really, really well. And it also helps them feel a lot better and safe within our care.
Since the introduction of these bags, we have shown a reduction in the emergency department reattendance within 7 days, rates for patients with a learning disability or autism diagnosis and the general population. We have also seen a reduction in the concerns raised by patients with learning disability or autism who attend our departments.
The scheme has been nominated for several awards and recognised nationally. We know that this will be helpful for lots of patient groups, so we're working with colleagues in the Trust to support their innovation too.
Leeds is setting the gold standard for tailored care for patients with learning disabilities and autism, which has now been adopted by hospitals up and down the country. Since the launch of the pilot in Leeds, over 19 hospitals have introduced these care bags for patients with learning disabilities and autism. We're really excited to be able to fund this project. It aligns with our priority to tackle health inequalities for patients here in Leeds.